Hey, week 7, the last one, and we're gonna basically just do a summary here. So everything you're gonna hear, probably 90% of it anyway, is old hat. You may pick up a new item here or there, and so let's get right to it. It's pastoral psychotherapy across cultures is the way I've designed this. It's strictly from the text, of course. Matter of fact, your text rating in this uh, correlates as it has done all semester. So let's see what we want to do here. Cultural influences. Understanding psychotherapy through cultural views, which has been the theme all along. So what are we talking about here? We're talking about a combination of things that make up pastoral psychotherapy, psychological theory. You've had a taste of that. Therapeutic practice, theology, biggie, biggie. Spiritual care, biggie, biggie, biggie. Psychotherapy, unrelated to pastoral care, uh, doesn't take into consideration theology, spiritual care, etc., which is kind of a given. So uh, that's where the difference lies. Pastoral psychotherapy recognizes emotional suffering that includes things like spiritual questions, moral struggles, faith concerns, existential meaning. I'm going to address that a little bit. Existentialism, you may or may not know what it is. The root word is exist, and the philosophical question is, why do we exist? So that's an existentialistic question. Existential meaning, uh, why are we here? As Christians, you know why you're here, but not everybody's a Christian. When I was going through my psychology PhD, um, we discussed existential meaning. It's how people try to, it's an attempt to develop meaning of why am I here on this earth? Uh, what is the meaning of existence? Very simple. So pastoral care goes beyond that. That making sense? Pastoral care uh, brings in God. Pastoral care brings in Christianity. And what we want to do is address the understanding of the inclusion of spiritual questions, or people with spiritual questions or with moral struggles, faith concerns. That all of this applies to existentialism. In the 60s, late 60s, early 70s, existentialism was a biggie because of the hippie movement, really, my generation, trying to figure out what life was all about. Uh, there actually wasn't a big uh, influence related to Christianity. People weren't looking in that direction per se. Christians were, but non Christians didn't really even consider that, at least not in a positive sense. So it's something that has to be kept in mind. Every person experiences faith somehow. Every person experiences suffering. They experience healing or seek it. They're all involved, for the most part, in family relationships. Uh, every person experiences mental health or lack of it through the lens of culture. So culture plays a major role, as you know by now. How people define problems, how they express emotions, uh, their beliefs about illness. Is this a demonic curse or whatever? I'm sorry about my phone, y'all. I forgot to mute it. Their expectations of counseling, their understanding of God and spirituality or lack of it. So a pastoral psychotherapist that ignores that, number one, you can't, or you probably wouldn't be a pastoral psychotherapist or counselor. We're interchanging the words here, by the way. Should have mentioned that. If you don't take that into account, you may unintentionally misunderstand your client's worldview. We use client. Client comes from this approach. It used to be that a psychotherapist or a counselor, mainly a psychotherapist, called people patients. Well, that's got a connotation, right? That's got almost a stigma to it. If we address you, welcome, I'm always happy to meet a new patient. I just told you you're sick. If I say client, this was developed not too many years ago. The psychological meaning of a client, that's working together. You talk about going to a lawyer. That's my lawyer, I'm his client. That kind of a feeling. We're in this together. I think that should make good sense. So we need to understand that we don't want to unintentionally set a negative tone. So you need a little psychological competence, but you also need a lot of cultural awareness, and you need to throw in a healthy bit of spiritual sensitivity. So pastoral psychotherapy is more than integrating psychology and theology. It requires you to understand cultural context, and that cultural context is going to include what faith and mental health influences there are. So what do? How do you understand culture and mental health? Well, you already know what culture is: a shared belief in values, customs, behaviors, language, traditions, social norms, the way you dress, blah, blah, blah. All those things you're already familiar with. Culture shapes how a person interprets their reality because they have a set of rules they go by. Not formal training necessarily, of course. It's what you grow up with. Mental health symptoms then look different maybe across cultures. We, for example, in Western societies and individualistic societies, let's use depression. That may be expressed through sadness, could be expressed through hopelessness, could be defined as emotional distress, the presenting of emotional distress. Some Asian cultures, compared to that, uh, express depression through physical complaints like headaches, fatigue, stomach pain. Uh, when they're overwhelmed, emotionally overwhelmed, they may describe it as fullness of head. There are just different ways that it's expressed throughout culture. Anxiety may be defined as excessive worry, physical tension. There's a psychosomatic component here. Spiritual concerns, fear of dishonoring the family. That'd be a collectivist thing. So you got to avoid assuming that every client experiences psychological distress in the same way. You have to view this through their eyes. Communication of suffering varies too. I'll give you some. It's better to give examples to understand this. Let's use the United States. A common expression of distress in our country is emotional. We exhibit emotional symptoms. Asian, for example, China, they may present physical symptoms. Latin America, emotional and relational concerns. African cultures, community and spiritual concerns. Native Americans, the Indian culture, imbalance within community and nature. I've had friends that they say full-blooded. Okay, everybody says, "Oh, full-blooded Cherokee." Full-blood means that your genetics are absolute 100%. And I've had friends that were. I've told you one story about the Apache Indian friend of mine, and when I was in the military, uh, very in tune with nature. So, as a pastoral psychotherapist slash counselor, you got to understand those differences. Don't make any diagnosis or treatment recommendations until you have an absolute, as far as you can go, understanding of the culture of the individual that you're working with. Make sense? All right, let's talk about different sections: spirituality, religion, cultural identity. I'm not going to get into this philosophical thing about religion. You say you're religious, I say I'm Christian. You know what the discussion is I'm talking about. Let's look at this without that with that in the back of our mind. So, religion and spirituality, deeply connected to culture. Faith isn't merely just a personal belief system. You have a faith family. It's connected to family identity, community belonging, moral values, cultural traditions, social expectations. These are invisible lines that are very well understood, by the way. So if I'm working in a diverse cultural setting, then what do I need to do? I need to understand what I just spoke to you about, but I also need to explore religious beliefs, spiritual practices, sacred traditions, meaning making systems. What is that? It's basically the way you try to establish an understanding. I need to have some kind of how do you do that? You ask questions. You ask pertinent questions in a gentle way, not in a positive, overbearing way. Hey, let's establish my understanding of what your culture says about whatever this is we're dealing with. So spirituality really provides resilience during difficult life experiences, and you've got to bring that out because their culture has a particular view of that. Um, the scientific background of this comes from research, and it basically and consistently demonstrates that spiritual resources can improve a person's coping during grief. It can do it for trauma, illness, even emotional distress. Spiritual beliefs may also contribute to guilt, shame, fear, or religious trauma. So you got to be careful in this area. I was I went silent there for a moment because I was trying to remember a story. I can't get the details right in my head, so I'm not going to confuse you with it. It was basically a research uh, uh, project that was done. I can't remember. Sorry. Anyway, so let's break it down this way. Since I can't remember my example, I'll just do it simply. Positive spiritual influences: hope, meaning, community support, prayer, forgiveness, resilience. Those are good things. What about the negative side? Every positive has a negative. Religious abuse, spiritual guilt, fear based theology, God's going to get you, shame, and even exclusion. So, and we're talking about cross cultural here. So these things will appear in different ways in different cultures, which is obviously an understatement. You have to, as a pastoral counselor, you've got to assess both of these. You got to look at the positive side, you got to look at the negative side. And again, questions. Don't assume you know. Don't ever assume. It's the worst thing you can do. I hope you're still with me, because I'm going to jump into another section here that I think you'll find interesting, because we're going to name some things here. These are cultural considerations related to pastoral counseling. These are major things. And again, this is not new to you. A lot of this you've heard it already, at least parts of it. There's several cultural dimensions that influence counseling relationships. That's again why we call it client, not patient, not it, them. And what are the two biggies? Individualism and collectivism. And I know I'm going to bore you to death, but I really want to make sure you're on the right page. Individualistic cultures, independence, personal achievement, individual choice. Me, I. I'm not saying that negatively. That's how we roll in Western cultures. Get ahead. I got more toys than you do. But if managed correctly, then it can be used for good. A collectivist culture emphasizes family loyalty, community responsibility. Me, I, as long as it benefits the whole community. And then group harmony. That's almost a given if you have the other two going right. So let's think of this. If a collectivist member comes into your, let me say that right, a member of a collectivist culture comes in to your office for counseling, and you encourage them to be independent, you may be destroying the, uh, or hurting their identity. Maybe not destroying it, but causing a problem, a further problem, because their identity is going to be closely connected to family obligations, community obligations, things I just mentioned. Got all that? I'm going to introduce something to you that I may have mentioned in the past and to do it again. And this is something that's not very well known by people outside of counseling, really, but you live it every day. You just don't know the nomenclature, probably. It's called power distance. Some cultures highly respect authority figures. Power distance should start to make sense already. A client may view pastors and counselors as experts. And by doing so, they think, well, the guidance shouldn't be questioned. Other cultures prefer collaborative relationships. A therapist has got to understand the expectations. Collaborative works everywhere. Psychotherapy, counseling, surgery. Now, you're not going to help the surgeon do your surgery, but there's discussions ahead of time, and they're pertinent. The second thing to consider is not new to you, although power distance is not new to you. You probably just didn't know the terminology. You do now. The second thing to consider is gender roles, cultural beliefs regarding gender significance, cultural beliefs that can influence counseling. You got to know how a person of a culture views gender roles. That has a Christian, or let's say a religious connotation, dependent upon what the religion is. Some cultures encourage emotional expression among women, but discourage it among men. So this is a role thing. And then others maintain strict expectations regarding that, but also how about marriage, parenting, leadership, family responsibilities? I think you're getting the picture here. Pastoral counselors have to understand what those beliefs are. And don't fall into the trap of stereotyping. Stereotyping is a form of bias. I'm thinking of a powerful word, and I got another word that's interfering with it. That's called role confusion, isn't it? Maybe not. I don't want to not use critical thinking when I'm doing a counseling session. So keep cultural dimensions in mind. It helps you avoid imposing your own values onto a client. Wish I could think of that word. You got to be in possession of humility, cultural humility. And we can apply that to a therapeutic relationship. No counselor can become an expert in every culture, period. But you need to be competent. You're not going to be an expert unless you go live in that particular culture for a period of time. So, how can we develop this without doing something so drastic? Lifelong learning, self reflection, recognition of personal biases, respect for client expertise. Look, they may know a whole lot more than you think they do. You might not be the first counselor they've been to. If you're, here's that powerful word, ethnocentristic. Ethnocentricity, and I've talked to you about it before, it means judgmental. If I'm ethnocentristic towards someone, I look down upon them. My attitude toward them is you're inferior to me because you're different. Uh, if you have those kind of attitudes, you're not going to make it as a counselor. So we want to have lifelong learning. We want to have, what does that mean? Take mental notes when you deal with people or write it down. Here's what they thought about this comment I made, etc. Self-reflection. How do I feel about this person? Recognition of personal biases. Respect for the client's expertise. I wanted to reiterate those because they're very, very important. The client most likely is expert in their own culture. But doesn't that make sense? Unless they didn't grow up there. Spoke to a lady this morning who is from El Salvador. And I've spoken to her numerous times. And it's very interesting to see or hear, rather, her comments about having been in the United States for 22 years. She has assimilated very well. Assimilation most frequently is based on decisions. I want to be this way. I'm not going to get into assimilation, rejection, etc. It'd take too long. I don't want to tie you up that long, but it's important. So, what I should ask as a pastoral counselor, in order to avoid some of these other things, is what does this belief mean to you? I'm going to ask the client that. How often, or rather, how does your faith community understand this, whatever the issue is? And then, what role does your culture play in this experience you're having? If you ask that the right way, calmly, lovingly, then you're going to invite curiosity and you may even earn respect. So be careful. Be Practice humility, cultural humility, learning from people. Don't have assumptions. You've heard that ad nauseum now. Cultural humility strengthens therapeutic alliances. They can trust you. They know you're not going to judge them. Now, nuts and bolts. Counseling / psychotherapy. Different approaches across cultures. Maybe you've all been sitting there waiting on this. I hope so. But this is the gist of the whole deal. Okie dokie. Not all psychotherapy approaches fit equally well across cultures. You have to adapt interventions while maintaining clinical integrity. Keep that in mind. You can't bend the rules. And let's begin with the most popular therapeutic approach there is, CBT. I hope you know what that is. If you don't, you will in about 5 seconds. Cognitive behavioral therapy. This was designed initially to treat depression. CBT, cognitive behavioral therapy, focuses on thoughts, emotions, and behaviors. We're dealing with thoughts in terms of you thinking negatively. Let me say it another way, searching out the negative. CBT wants to transition you to searching out the positive. A spin-off of that became known as positive psychology. When you're working cross-cultural, you have to recognize beliefs probably were shaped by family. They could also have been shaped by religion, and they most obviously are shaped by cultural expectations. Basically, families and cultural expectations mesh, hopefully. And then, depending on the family, religion, if you're coming to see a pastoral counselor, there's not a guarantee that they're a religious person. There's no guarantee that they're saved. Don't assume anything, right? I think I might have said that already. So, CBT. Thoughts, emotions, behaviors. Family systems therapy. Something you've probably never heard of. You may not have heard of CBT. Interconnected relationships. That's what systems is all about. Family systems, if you're going to use that approach, often align very well with collectivist worldviews because they focus on relational dynamics. They don't focus, it doesn't focus on individual pathology. Let me address pathology again real quickly. Pathology means diseased, but when you talk about pathological, try to apply pathological this way. Maybe you'll get I can give you a good understanding of this. If I say pathological means diseased, then what do you think of right away? Some biological malfunction, right? Okay, so what about a pathological liar? Is that a diseased liar? No, it's somebody that's got some sort of a self-esteem thing, or there could be some biology there. They may have this need for dopamine experiences, whatever the case is. So, but yet we can use pathology and mean diseased in quotation marks. Narrative therapy, third kind of therapy. It encourages clients to tell their stories. That's why it's called narrative. It allows a client to integrate cultural identity, spiritual beliefs, family traditions, personal experiences. All of these things come out in the story. Who's the leader here? They are. So it's patient-centered care. existentialistic or existential in spiritual therapy. We're going to stop with our therapeutic stuff after this, because if I don't, we're going to be here 2 weeks from now. So I told you earlier it was the big questions, the question of existence, existentialistic thinking. Well, we call this therapy existential and spiritual therapy, and here's why. Clients want answers to things like, why am I suffering? Where is God? What gives life meaning? Have I angered the Almighty? I mean, anything that relates to spirituality. And existential in this sense means, why am I existing in these circumstances? Where is God? We go through times when we think that way. Billy Graham told his mom one time he didn't like when God was, I don't remember the exact words, he didn't like when God was silent because he felt far away from God. And his mom said, when you feel far away, that's when he's the closest. Uh, Something to that effect. So, where is God? Part of the questions that you may hear in existential and spiritual therapy may apply in those circumstances. Why do you need to adapt all this? You need to adapt these therapies. Which one do I choose? Well, you have to respect some things in order to do that. Just because we have these CBT, etc., doesn't mean they work in every set of circumstances. So if it works in one cultural setting, it might not work in another cultural setting. So what do? We try to make adaptations. Remember that we adapt things within the restrictions of the of ethics. You can't change theories just to meet a condition. You change approaches. So how do I do that? Well, I look at faith traditions. I have to respect these things. Faith traditions, language. Do you speak their language? If you use an interpreter, I hope that it's in a situation where the interpreter is a good interpreter so that the meaning of what you're saying doesn't get changed. So language is important. Community values. You're talking collectivists here. And then cultural expectations in general. So, if you're, we'll wrap it up with this. If you are going to be an effective, competent, culturally aware pastoral counselor, then what do you want to do? Well, here you go. This is a simple list. Ask your client about cultural background. Ask them about faith traditions. Ask them about family values. Ask them about spiritual practices. Have you heard that before? Yeah. Number 2, avoid assumptions. Have you heard that before? Don't assume beliefs based solely on ethnicity or religion. You're talking with individuals here. Integrate spiritual resources when they're appropriate. When I first began my counseling training, I was warned that don't assume that every time you're going to have a session with somebody that they want you to pray with them or you want to pray together. Some people aren't comfortable with that. We're not downing prayer, obviously, by any means, but there's some people that's not really on their agenda. So be careful. So when it's appropriate, prayer, and all of these basically fall under that same guideline. Prayer, scripture, meditation, religious rituals, and spiritual community. What spiritual communities are they a member of, if any? You also want to recognize historical trauma. What is their background? And again, you've heard this: racism, colonization, discrimination, religious persecution. Don't get too wound up about colonization. Matter of fact, I don't even want to spend time at the moment explaining that. I'd rather you look at that, do a search about colonization related to pastoral counseling, because you're probably not going to see it on an exam, but I want you to know about it. And then you need to maintain cultural humility. And all these, again, this is a summary. Be curious, but be respectful and be willing to learn. So the goal is not to become an expert, as I said before, because you won't unless you go live there. But you can be an expert listening, learning, and responding respectfully. It's kind of common sense, right? I hope you've enjoyed this. I hope you've learned something. I know that your backgrounds may put this information in different categories, but maybe you heard some new things. I hope so. So it's my pleasure to be with you. Have a great day.